It is those rising cases causing COVID hospital beds to fill up. Now the state has a field hospital in Cranston preparing to take patients. Put together in April, the site has not accepted patients yet, however. The state is warning that could all change within weeks. Brandon Truitt is live outside that center in Cranston this evening. And Brandon, today you got to look inside that setup.
Well, Brian, I got to tell you, this is something we're just not used to seeing in this country. Bed after bed, all lined up in rows. The doctors here are telling us that they're ready if needed.
This is a last resort.
Cases on the rise and hospital beds filling up. Dr. Laura Foreman says this last resort is quickly becoming inevitable.
This is an option, but we want to do everything we can to avoid using this.
What was once the Citizens Bank call center transformed into a makeshift hospital. Those running the site say it's been in place since April, and they've been running drills here ever since.
We had just team members here working every single day.
More than 350 beds separated into 3 pods. This space is designed for COVID patients. There's oxygen at each bed and an on-site pharmacy too.
We put a lot of thought into what type of patients we would care for here, who belongs here, who doesn't.
The state says this field hospital cost $8 million to set up, another $3 million a month to keep it going. The state says that number will go up to $15 million a month when the hospital is staffed and ready to receive patients. All of that said to be coming from federal funds. In the meantime, doctors say the need for this space is likely, but it's not set in stone.
This is an option once we have run out of every other option, and it absolutely is something that we can avoid. If people stay home now, if people avoid social gatherings now, if people avoid any unnecessary activity now, the pandemic can be stopped in its tracks.
And you know, we really heard those same sentiments echoed by Governor Gina Raimondo yesterday. The governor then saying that unless behavior changes quickly and in a drastic way to improve, we could see people rolling in this center within the next 2 weeks, guys.
Brandon, you saw yourself today and also saw in the video we were just looking at what the setup looks like. But today you're also learning there are concerns about staffing for that hospital.
Yeah, the doctors here telling me that in terms of staffing, it's really becoming a logistical challenge. And that's because if you remember back in the spring, elective surgeries really stopped. So that freed up extra hands to help in the pandemic. That's just not the case this time around. Elective surgeries are still happening. So the doctors here are really asking anyone with medical experience that might be willing to help to consider stepping up, guys.
Well, Brandon, we all certainly hope we will not need to use that facility.